We've received a phone call in December of 2020 that there was an outbreak occurring in China. You know, the government said to us, be aware, there's something coming in China. We're not sure exactly what it is. Can you give us a list of things you can provide us? And so we quickly went to work.
I have fought 5 epidemics in my career already. So I was ready and willing and able to move, and I had prepared for the move that was necessary.
We were trying to provide the resources that the scientific community needed to develop diagnostics for COVID, use for vaccine development, as well as just understanding the mechanisms of infection.
We hold a number of materials that support infectious disease research. So that plays a critical role in pandemic response. So when there's a public outbreak or public emergency, they need to go back to the central library to understand what has been deposited or what has been available previously from some of these pathogens, and we're the place that they go to.
But you have to start with the critical material that's involved in the epidemic, and these are the microbes, okay? Then you have to have the materials that you need to support the diagnostics, the prevention, the treatment, okay? And we had all that.
Our staff did not disappoint. They got in motion immediately and worked 24 hours around the clock every day to provide the materials that companies needed to rapidly develop the diagnostics for the pandemic. New COVID vaccines were developed using ATCC's materials.
ATCC is really a key and essential member of that first response community. When the outbreak occurred, both CDC and NIAID said, what can you guys do for us? And we gave them a portfolio of solutions. And we were able to make distribution within 4 days. And that's remarkable. Normally something like that would take weeks to a month, but because of the concentrated effort by our staff, we were able to get the virus in the hands of those researchers who needed it within days.
ATCC knows how to rally itself during times of pandemics. Really, there hasn't been a pandemic that ATCC hasn't played a critical role in.
For example, when Zika was a public health emergency, the original strain that was isolated on Zika was found at ATCC. It was deposited in 1947.
So we are an organization that is absolutely prepared to respond.
We're going to have more epidemics, pandemics. It's just obvious. The only way to deal with it, we have to be prepared to prevent it, to diagnose it, and to treat it.
We all know what our mission is here at ATCC, and that mission is to provide authenticated, genuine biological materials to the world to solve problems.